in my computer. So one of the most important topic today, which I was going to discuss with you all, is about a group of viruses which has a lot of concern to the healthcare workers and especially to the dental professionals. Why dental professional? Because you are all involved in the micro procedures on your patient, and it is possible that you might get the needle stick injury during your patient care. And few viruses are enough to get the infection from this group of viruses, which can lead to the a disease of liver, that is hepatitis. And then as it is causing the disease in the liver, the name has been also given as a hepatitis. So these are the group of viruses which have been implicated in the causation of the disease to the liver. So this is what I was referring about. So coming to the introduction, the term viral hepatitis refers to a primary infection of the liver by any one of heterogeneous group of hepatitis virus. So there are various groups of viruses under this term hepatitis: A, B, C, D, and G, and all of them are responsible for causing the infections to the liver. That's why the name has been given as a hepatitis. Hepatitis viruses are taxonomically unrelated. It means that they are similar in the structure, or taxonomically they are similar, except for B, which is a DNA virus. So rest of them are the RNA viruses. So all A, B, C, D, G are taxonomically unrelated, but only B is a DNA viruses. So rest of them are RNA viruses. We have seen this in the general properties of the viruses. Viruses have been classified as either on the basis of presence of RNA or on the basis of presence of DNA. So except hepatitis B, all others are RNA viruses, and hepatitis B is the DNA viruses. The common feature is their hepatotropism and ability to cause a similar ecteric illness ranging from severity to fatal. Most of the time, the disease is not fatal. The patient is able to get cured, but if it is untreated for a long time, or the patient has a certain amount of immunocompromised status, that could lead to a fatality. So this is something which is a very concern to all the dental professionals, because as I told you, infecting dose is very small. If you compare with the HIV, it is very small. So even a 10 to 20 virus are enough to cause the disease. That is why you have to be very careful while taking care of your patient. You need to wear the gloves, because if the injury occurs, then it is possible that you may get transmission of these viruses through those needle stick injuries if the patient is positive for hepatitis B, C. They cause indistinguishable acute illness, but their differentiation is based on serological and molecular markers. So it is possible to differentiate these infections based upon the serology and the molecular markers. There are two types of viral hepatitis. Broadly, it is divided into two based upon their infections. Route of transmissions, not infection, route of transmissions. Infective hepatitis occurs sporadically or as epidemics, affecting mainly children and young adults, and only A and E are involved. So this is the type of hepatitis which gets transmitted to fecal-oral. So it means that it is transmitted through ingestion, basically. It does not transmit through parental. Its routes of transmission is fecal-oral, and the viruses which includes under the infective hepatitis are hepatitis A and hepatitis E. Both of them are transmitted fecal-orally. And the second type of viral hepatitis is serum hepatitis. And this is transmitted by blood transfusion, sexually or parenterally. Parenterally means from infected mother to her child. Only B and C are involved in this. So if out of 5 hepatitis viruses, A and E are fecal-orally transmitted, and B and C are the transmitted by blood transfusion, sexually or parenterally. So this is the basic difference between the viral hepatitis, that is infective hepatitis, as well as the serum hepatitis. So coming to the clinical features of this virus. Majority of time it is asymptomatic. As this is not that serious. In majority of the time it is asymptomatic, and patient does not suffer from the severe illnesses. And incubation period is 2 to 6 weeks, so almost 1 month. The incubation period is there. We came to know the term incubation period in recent lecture, in the second lecture of virology, where I was talking about the incubation period. It means that the time taken from the injection of these etiological agent and to show the signs and symptoms or disease, that is called as incubation period. At that time I had referred about the COVID-19 also. It requires 7 to 14 days. That is its incubation period. And here, excuse me, here it is the 2 to 6 weeks, almost 1 month. There are two stages in the hepatitis, the prodromal or pre-ecteric and ecteric stage. These are the two stages in which the disease occurs or clinical features occurs. In prodromal phase, the period between the appearance of initial symptoms and the full development of a rash or fever. This is the prodromal phase. And what is in the pre-ecteric? The period prior to the appearance of jaundice, and then ecteric is the presence of jaundice. In these hepatitis, if the patient is suffering from jaundice, the bile salt, bile pigment will automatically increase. Even the eyes, color of eyes are they changes to yellow, and you can predict that the patient is suffering from the jaundice. Onset may be acute or insidious. It may be sudden or it may be slow, with fever, malaise, anorexia, nausea, vomiting, and liver tenderness. These are the clinical features seen in the hepatitis. Usually, the disease subsides with the onset of jaundice. Recovery is very slow over a period of 4 to 6 weeks. It takes another couple of weeks or almost a month to get rid of this disease. And as I said, it is rarely fatal. It is not that obvious that the patient will die. It is not so. Now we will learn one by one about these viruses. What are their structure, what it consists of as a genetic material, etc. Starting with the hepatitis A, it is demonstrated in the feces of experimentally infected human volunteers. It measures 27 nanometer non-enveloped RNA viruses. So we have studied this enveloped and non-enveloped viruses, again in the RNA also and DNA also. So this is the non-enveloped RNA viruses belonging to picorna viruses. This is the family of the hepatitis viruses. Only one serotype is there in the hepatitis A. Please excuse me today because I'm suffering from upper respiratory tract infections. So madna mein khokhlen thoda sir, please excuse me for this. Only one serotype is there. Am I audible properly, Prayag? Prayag?
Yes, sir.
Yes, sir. Okay. I'm just confirming because I'm having a sore throat little bit. Resistant to inactivation by heat at 60 degrees Celsius for 1 hour. That is why if you remember in the sterilization, we have learned about the pasteurization. Generally 63 degrees Celsius for half an hour. So this is the virus which resists the higher temperature, that is even the 60 degrees Celsius. So it requires to be heated at 1 hour, then only you are ensuring that the viruses have been inactivated. They can be inactivated with the help of ether and acids, and at the lower pH, that is acidic pH is useful in the inactivation of this virus. But inactivated by boiling for 1 minute. So if you boil any infected material for 1 minute, the hepatitis virus A is easily get inactivated. The infection is seen only in the humans. This is something which is unique. Humans are the source of infection. As I said, transmission is through fecal oral route by ingestion. If a contaminated water is ingested, then there is a possibility of getting the hepatitis A infection. What happens when the virus enters in the body? It multiplies in the intestinal epithelium and reaches to the liver by hematogenous spread. That means through the blood system, and sheds in the feces during late incubation period. So later part of the incubation period of the virus leads to the shedding into the feces. Brief viremia occurs from the entry reaching to the blood and then going into the feces. That period is called as viremia. The virus is present in the blood is called as viremia. So a brief viremia occurs. Generally, it occurs sporadically, means one or two cases, or sometimes it also occurs as outbreaks. I usually refer this incidents. Hepatitis A generally means occurs as a sporadic, means one or two cases somewhere, but sometimes it occurs as a outbreak also. In Baramati, almost 12 years back, there was a huge outbreak. And the reason was the drainage pipeline was located above the drinking water pipeline. And what has happened, the drainage pipeline has got the leakage, and at the same time the drinking water pipeline was also having some holes in it. So the water from the sewage water, the sewage line was percolating into the drinking water, and that was the reason there was an outbreak in the Baramati. It's almost 12 or 15 years back, and there are lots of cases which were reported during that time. It was, I think, 2004, I think, probably. Occurs sporadically or outbreaks. Diagnosis by detection of antibodies. We generally don't cultivate these viruses in the lab because cultivation is very difficult, as it requires a lot of efforts and the high containment laboratories. So what is the easiest way to detect the viruses? Detect the antibodies. We have learned this in the antigen antibody reaction, that is the serological reactions, most commonly used to those infectious agents which cannot be able to cultivate in the lab. And viruses are not easily, they are cultivable, but it cannot be cultivated in the normal lab. You have to have a research lab. So the best way to diagnose these infections are by detecting the antibodies. And again, if you detect IgM, it means that it is a recent infection. Right now, patient is suffering from the infection. Or if you detect the IgG, it means that it was a past infection or very past infection. Then prophylaxis by immunoglobulins. How do you prevent? There is no prevention actually. There is directly prophylactic treatment, that is therapeutic treatment, and that can be achieved by the giving the ready-made immunoglobulins. That was about the hepatitis A, and now we will learn about the hepatitis B, which is the most common, most dangerous for all the healthcare workers. As I said in the earlier slide, this can transmit through blood transfusion, sexually or parenteral, or needle stick injuries, accidental injuries in the clinic or in the lab. And there was an article in the Times of India again a few years back stating that the most vulnerable population for acquiring hepatitis B and hepatitis C virus are the dental professional. After that, there is the nursing staff, and the second most vulnerable population is the dentist. They have said, because you are involved in so micro procedures on your patients, and there is a possibility of getting those injuries, needle stick injuries, even through your probes, and that may lead to get the hepatitis B infection or hepatitis C infection. But the only beauty or the advantage of preventing of this infection is by taking the vaccination. I think probably you all have taken in the first year. First and second dose was completed, and third dose you were waiting, and suddenly this COVID-19 has started, and I don't know how many of you have got the third dose. So that third dose is essential. Even two doses are enough, but third dose is very essential because your memory has to be manufactured, or there has to be a memory which will last long till your death, till your last breath of life, and that will ensure protection against the hepatitis B when you are working with your patient. If you did not take the third dose, please do so, because to avoid the hepatitis B virus, it is very essential. This is the only virus which can be prevented. As I said, which can be prevented. So vaccine is available. So you take your third dose if you have not taken the third dose. If you have taken two doses, you go for a the demonstration of IgG antibodies. It is also called as HBS antigen antibody titer. So that is very essential. If you have more than 10 international unit IgG response, then you are protective. You have the protective immunity. If you do not have the 10 international unit 10, then you need to take the booster dose. And healthcare worker who are involved in the patient care must take the booster dose every 5th year. So you better take take that vaccine. Most widespread, as I told you, this is you cannot. Why it is most widespread? You cannot predict who is positive for hepatitis B, because because there are no obvious signs which can be notified in the patient. As I said, it remains chronic carrier in the patient. The patient is asymptomatic. That is what I said. Patient is asymptomatic. It means that it is very difficult to find out the person is actually positive for hepatitis by just looking at him or her. So you have to test for that person's blood to find out the antibodies. Okay. So it is most widespread, and that is why you need to take care all the infection control practices. And this is the only virus which can be prevented by taking vaccination. So please take your vaccines doses for 3 doses if you haven't taken. Okay. 1/3 of the world population. See, disease burden in the world. 1/3 of the world population are infected, and about quarter of them becomes carrier. This is more dangerous. I may be infected and I become chronic carrier. So I have a virus in my body. I may not be suffering from the signs and symptoms, but I'm equally responsible for my partner to transmit that infection sexually. So that is why it is very dangerous. So you have to be very careful while treating this patient, because you never come to know who is positive and who is negative for this virus. Incubation period is 1 to 6 months. If you look at the other viruses, hepatitis group of hepatitis virus, there is 1 month incubation period. Here the incubation period is little longer, 1 to 6 months. And in the HIV, I have told you 3 to 6 months. Okay, so more dangerous. Clinical features same as of hepatitis A. There is nothing different in the clinical features of any of these hepatitis virus, because ultimate target of organ of infection is the liver. Onset is insidious. Insidious म्हणजे छुपा असं काय म्हणतात त्याला, सावधानीने, सावकाश, insidious, छुप्याने असं काहीतरी म्हणतात. And fever is not prominent. In the hepatitis B, fever is not prominent. Mortality is there, and it is about 0.5 to 2%. If you look at the structure of this virus, hepatitis B, it is 42 nanometer, and it is a DNA virus. This is something which you need to remember. This can come as one of the MCQ for all of you. 42 nanometer DNA virus occurs throughout the world, and no seasonal distribution is there. In the rainy season, that hepatitis A or E can transmit infection, but there is no seasonal variation in the hepatitis B. Natural infection occurs in the humans. 5 to 10% adults, 30% children, and 90% neonates becomes carrier. So it is very dangerous if a mother transmits infection to her baby. So that baby may turn out to be a chronic carrier. And it is mainly the blood-borne. So if I'm positive for hepatitis B, if I'm donating my blood, I'm also transmitting the infection. Acute hepatitis B virus infection with recovery, typical serological course. If you look at the y-axis, there is a titer. Titer we know now that the cutoff that antibody, quantitative measurement of the amount of antibody is called as titer, right? If you remember. And on the x-axis, there are weeks after exposure. In the first 4 weeks, almost 1 month, because 1 month is an incubation period. So after 1 month, you start seeing the HBs antigen. If you see that brown color, or what brown color it is, I think HBs antigen positive. So initially antigen is positive. Then what happens? Total anti-HBC. Core HBC is the core antigen, and that is positive, and it remains quite long time. And then in the yellow, it is IgM antibodies. Now it is saying that right now infection is there. IgM is the recent infection. Okay. And then after that, HBs antibodies are detected, and they are also detected for a long time. So this is the phases of our detection of the various antibodies at various stages. If you try to detect the antigen or antibody in the first week or second week, you may get negative results. So what you need to do, you have to wait for a month, because that is the incubation period. And after that, you can actually demonstrate the antigen. SBS, S stands for surface, C stands for core antigen, and E stands for envelope antigen. Okay. So this is how you have to see the, demonstrate the antibodies against the hepatitis B. Now coming to the third, hepatitis C, it is the transmission is of B. It is also called as non-A, non-B hepatitis. Neither it is A nor it is B. That is why it is also called as non-A, non-B hepatitis. But the transmission of infection of hepatitis C is similar of hepatitis B. It means that it also transmits sexually, parenterally, or through blood. And the danger part is there is no therapeutic treatment, no preventive treatment. And that is the most dangerous part of hepatitis C. And that is why you should be very careful more than hepatitis B. Hepatitis B, we have the prevention, but hepatitis C, there is no prevention at all. Incubation period is 15 to 160 days, almost किती महिने किती 60 days म्हणजे 4 महिने almost, okay, 4-4.5. Usually milder or anicteric in the nature, and 50 to 80% leads to chronic infection, and that is why you have to be very careful. Infection transmission is through blood, same as of hepatitis B. And if you measure the size of the virus, it is 50 to 60 nanometer, little larger than the other one. And single-stranded RNA viruses, diagnosis usually by detection of the antibodies by the ELISA test. And the fourth most important group of virus in the hepatitis D. The D stands for Delta virus. The D has been taken from the Delta viruses and is defective RNA virus. This is something which is which occurs as a nanoparticle with the hepatitis B virus. It is a defective RNA viruses and it is spherical, 36 nanometer. Mode of transmission is same as of HBV, hepatitis B viruses, and this is not that commonly seen in the community. It is rare. Distributed worldwide, no specific prophylaxis exists till date. Even like hepatitis C, even hepatitis D does not have neither the preventive treatment nor the therapeutic treatment. And this is the last one, which is hepatitis E virus. And to remember, A and E are always transmitted through fecal-oral, and B, C, D are transmitted always through blood-borne. Hepatitis E transmitted through fecal-oral route, and incubation period is 2 to 9 weeks, almost more than 1 month. 1 month. The infection is generally mild with very low fatality. It is not that fatal as compared to hepatitis B. But again, here you may get sporadic cases as well as the outbreak. Outbreaks are very rare in the hepatitis C, but the sporadic cases will occur usually. If you find out the structure of the virus, it is again spherical and 30 to 34 nanometer and is a RNA viruses. If you look at the genetic material, except all of them are RNA viruses. And for serological demonstration, what is the basis of diagnosis of hepatitis C? You must detect IgM, which will tell you that it is a recent infection, or you can detect the IgG, which will tell you the recent infection or recent past infection. So IgG and IgM are useful in diagnosis of hepatitis E virus. This is one more viruses which later has been added to the group of hepatitis viruses, hepatitis G. Very recently it has been added to the list of hepatitis, but till E is more common. But hepatitis G was also been detected, and it was detected from tamarin monkeys inoculated from a young surgeon with acute hepatitis RNA, which has been detected in patients with acute, chronic, and fulminant hepatitis. This is little, severe in the if you compare with the other viruses, and it was detected from a young surgeon who was accidentally infected with from the tamarin monkeys. It is also a blood-borne viruses. So this is something which you need to remember. Hepatitis G is RNA viruses, but can transmit through blood-borne viruses. I have done, this is something which is a small topic, but it carries a lot of weightage in your professional life, not as a